Hello, good day to all. Welcome to Weconomy. So today's topic is really interesting. Why should we learn the language of medicine? The medical terms about anatomy and physiology. I get a lot of queries from students like why should we learn so many terms if you are going to enter medical coding? So, precisely, medical terminology is a language used to precisely describe the human body, including all its components, processes, conditions affecting it, and procedures performed upon it. Medical terminology is used in the field of medicine, it's used by doctors. Understanding medical terminology can make all the difference in critical health situations. And while understanding medical language is serious business for care providers, learning medical terminology can actually be a thought provoking, interesting crash course in the history and development of language and parts of speech. So, for those who are new to or looking to enter the medical field, having a firm grasp on medical verbiage, roots, and meanings can give you a leg up as you continue your studies and progress in your career. To get you started, here is our introductory guide to medical terms, which will serve as a solid foundation as you work to diversify and enhance your medical language skills. So, guys, it's really important that you become very familiar with the medical terms so you succeed as a medical coder. So, some of the terms are from Greek and Latin languages. Medical words derive from either Greek or Latin roots because both the ancient Greeks and the ancient Romans made significant contributions to the development of medicine in Europe. In order to understand and form medical words, you need to learn both the roots that form those words and the grammatical rules that govern their formation. So, although medical terms have been drawn from many languages, not only Greek and Latin, a large majority are from Greek and Latin. So, some familiarity with the meaning of the most frequently used roots, prefixes, suffixes will clarify the whole field. So, with a little study, it will be found that the long and formidable sounding medical terms are a combination of words which describe parts of the body, a function, or a condition. The basic terms occur over and over again in various combinations. A knowledge of the meaning of the roots, prefixes, and suffixes enables the student to analyze the medical terms into component parts. This is of greatest aid in learning to understand the vocabulary of medicine. Some names of diseases given by the ancients and still used today are in many instances simply descriptions of the outstanding symptoms. For example, hydrophobia, fear of water. So, for rabies, that is the term because the inability to drink is an early characteristic sign of the disease rabies. Okay. Medical terminology often uses words created using prefixes, suffixes in Latin and ancient Greek. So, a medical term will have a root, sometimes even two roots will be there in a single term. Then you will have a suffix and a prefix. So, all this is similar to the English language. So, in medicine, their meanings and their etymology are informed by the language of origin. Prefixes and suffixes, primarily in Greek but also in Latin, have a droppable O, the vowel O. Okay, so just an example for you how this works. You must have seen the suffix itis, itis. So, this is originally the adjectival ending used with disease conditions. So it is now used alone and has acquired the significance of inflammatory disease. See, for example, if this suffix is used with the appendix, that is appendicitis, it means inflammation of the appendix. You need to read medical terms backwards. Inflammation of the appendix. Okay, itis means inflammation. So you should know the what is the root, what is the suffix and prefix, and then compound words to understand the medical terms correctly. Arthritis. So that is arthra means joint. Itis is inflammation. Inflammation of the joints in our body. Osteoarthritis. Bronchitis. Itis of the, that is inflammation of the bronchus, lungs. There is a tubes which leads into the lungs. Bronchus. Otitis. So inflammation of the ear. So this is how the medical terms work. There are some complex medical terms too, which are really big. Some words are quite huge, like this term, pneumono ultramicroscopic silico volcanoconiosis. So in simple terms, it is like a lung disease. Pneumo means lung. So a lung disease caused by the inhalation of very fine silica dust, causing inflammation in the lungs. So this is at 45 letters. This is the longest word you will find in a dictionary. So it is pneumono ultramicroscopic silico volcanosis. Okay. So this is the scientific name of a disease that causes the inflammation in the lungs because of dust, especially silica dust. So in the picture you can see a instrument. So what is that instrument? It is a sphygmomanometer. Sphygmomanometer. What is it used for? It will be tough for you to answer that question, but you would have seen it in hospitals and with doctors, nurses also. So it is nothing but a device to measure your blood pressure. Medically it is called hypertension. High blood pressure is called hypertension. So this is sphygmomanometer. Whenever you encounter a big term in coding, just break it up into parts like suffix, prefix, root. Then you will understand the meaning easily. And you may think it is tedious at first, but with practice this becomes easy. So here you see the medical root words. Some of the root words are entero. This is for intestine. Enteritis means inflammation of the intestines. For example, gastro. Gastro means stomach. Gastritis, inflammation of the stomach. So we would have all had this symptom in our lives at some phase. Gastritis. I have some gastritis, so I think I should have my food very early today. See, we have that burning sensation in the stomach, so that is gastritis. Genu means a knee. Genu valgum means knock knees. Lacrimo refers to tear. Miringo is eardrum. That is a medical term, root word for eardrum. Myringotomy, tympanotomy means both the terms mean cutting into the eardrum. Colon, col slash o. Okay, that is colitis, inflammation of the large intestine, colitis. So this is a few examples. There are numerous words in the language of medicine. This is just giving you a glimpse into this medical terms. So we have completed root words. So suffixes, some of the examples are, we have already seen itis, means inflammation. So osteoarthritis, this is the inflammation of the bone joints. Then you have algia. This is also quite common suffix, medical suffix. Algia means pain. So neuralgia means pain in the nerves, nerve pain. Okay. Oma means tumor. Melanoma, this is a type of skin cancer. Tachypnea. Pnea means breathing. Tachy means fast. So fast breathing, quick breathing. Tachypnea. Hemostasis. Stasis means stop. Hemostasis. Stop the blood flow. Usually you will see this term in surgical reports, operative reports. Hemostasis was obtained. Okay. After the incision which was made by the surgeon was stitched up, sutured up. So there is no more blood loss. Okay. Hemostasis. The bleeding has stopped. That is hemostasis for you. Stasis means stop. Chlorophyll. For example, uh, chlorophyll means a green pigment. So here you see the prefix. Chloro is a prefix. Meaning is green. So example of the use in medical terms is chlorophyll. Chromato. Meaning is color, chromosome. Cyano. Meaning is blue, cyanosis. The patient's face was cyanotic, meaning it was bluish in color. Erythro meaning red. Example of use in medical terms is erythrocyte. Commonly we call it red cells, red blood cells. Leuco meaning white. Leukocyte, white blood cells. Melano meaning is black. The term is melanin. See, prefixes are located at the beginning of a medical term. The prefix alters the meaning of the medical term. It is important to spell and pronounce prefixes correctly. Many prefixes that you find in medical terms are common to English language prefixes. A good technique to help with the memorization is the following. Start by reviewing the most common prefixes. Consider common English language words that begin with the same prefixes. Compare them to the examples of use in medical terms. Some common medical prefixes are hyper, meaning is above or excessive. Example of medical terms for hyper is hyperthyroidism, hypertension. Inter is a prefix, meaning is between. Intercostal, intercostal meaning in between the ribs. Intra, within, inside. Intramuscular, so the injection has to be given IM, intramuscular. Macro, large, long. Macrocephalus, a large head. There was a question as to how to pronounce these terms as they are from another language like Greek or Latin. So I'm just reading out a few terms. For an example, hemorrhage, herniorrhaphy, esophagoduodenoscopy, commonly called EGD, rhinorrhea, neurorrhaphy, amniorexis, hysterectomy. When you cannot pronounce a certain word, it's quite new to you, just break it up into prefixes, root, suffix. It'll be easier for you to read it out. So this is the importance of medical lingo, why we need to learn them, be familiar with them, So as a medical coder, you should know the medical terms. And also you need to be familiar with the medical lingo because you're going to be coding the medical charts which will contain numerous medical terms. So these are terms usually not used by all of us in our day-to-day life. Medical personnel have their own language to communicate with each other. Medical coders who have a good understanding of medical terminology, anatomy, and pathophysiology can communicate more effectively with other healthcare professionals. When medical coders can understand medical terms used by physicians, they can ask informed questions, leading to more accurate coding and billing. So you talk the same language as the doctor, so he understands. See if there is any more information that he should be giving, or he can even explain why he chose this exact medical term. And also ICD coding. In that book you will find all the medical terms listed with the code next to them, that is the ICD code. So once you're very familiar with the medical terms, it will be easier for you as a coder to pick the correct ICD code. See here,